It's Wendy Bowen, physiotherapist with Know Your Body Better. So we're going to talk about back pain today, and there's a few different patterns of back pain that we look at. The first one is flexion. That's when you get back pain more when you're sitting or bending forwards. That can be tight muscles in here, but it can also be the disc. So the disc is the cushioning or what's in between the two vertebrae or the bones. The second type of pattern that we often look at is extension back pain, and that's when you're standing, walking, bending backwards, having to do work overhead, and you get pain in your lower back. When I think of that pattern, I tend to think of wear and tear or jamming of the joints in the lower back. The joints in the lower back are more up and down, so again, the low back is more for flexion or extension rather than rotation, which is the twisting. But if we're tight in our hips and tight in our mid-back, then when you rotate, you can't rotate through those areas, so you'll rotate in the lower back and break down. One of the common things I see with people who have this extension pattern of back pain is that when they are standing, they are tight in their hip flexors. So they stand, because we're not going to walk like this and look around, so they stand, arch their back, overarch their back. The other tightness is tight in these lower back muscles, or the muscles that run down either side of the spine, the paraspinals, and those are tight and they're going to get over compression. So we get this hyperlordosis, arch in our back. So what can you do about that? Well, one is if you get that type of pain, when you're standing, you can put your foot up on something, put your knee up on something. It takes some of the strain off that lower back. The second thing you want to do is make sure you're stretching out these hip flexors and your lower back muscles. So really good hip flexor stretch, easy, is just this quad stretch, but making sure that you're getting the pull. So I get into this stretch for the quad, pull it through here so I feel it there. I'm not arching my back, I'm bringing my hip forward. You can get a little bit more of a stretch with your foot up on something higher. And again, being careful I'm tightening my tummy, so I'm not getting my over stretch in my lower back or over bending backwards. The other one you can do, I love this one, where you just sit and you just bend forwards. And you can stretch out the lower back that way. The third way is, third or fourth, is just to lie on your back and just bring your knee up to your chest and stretch out your lower back. Or bring both knees up to your chest and stretch out the lower back. So those are a few things you can do if you're getting that type of back pain where your joints are being jammed and compressed. We want these muscles to be more relaxed so you're not compressing your lower back. So it's Wendy Bowen, physiotherapist with Know Your Body Better.